I'm going to introduce now, where is she, Jane Newbig. So she is on our Health and Wellness Committee, and I just want to give a shout out to the Health and Wellness Committee because they're the ones hosting this wonderful presentation today. Jane is going to introduce our presenter, and so take it away, Jane.
All right, thanks. Thank you. It is so great to see everybody. Come on in, we have chairs right here, help yourself. I'm very pleased to introduce Dr. Laura Covill, and I want to tell you just a little bit about her. We're very lucky to have her here at the lake. She's not only has a doctorate, which means, she is a doctor, right? She has a doctorate in physical therapy, and she is board certified in 3 areas. Her areas are orthopedics, manual therapy, and I thought this was interesting, yoga therapy. And so to me, that's very interesting. So I was pleased to hear that. She was teaching out in Des Moines for over 18 years, and her experience was at the Des Moines University Osteopathic Health Sciences University. So she teaches physical therapy, and it was a graduate program. And she now practices at Lakeside Manual Physical Therapy, which is in Unionville, which is not really far away, but it is outside the lake. We have to go outside that gate. It's 20 minutes away, but I just thought I'd throw that in. She specializes right now in working with seniors. So she's nearby, and I think that's really interesting. I don't know how many of my friends go to Laura, but lots. So that's interesting, a lot of seniors clients. And her other interests include things like volunteering for the Orange County Public Schools. She's a tutor, and she works at the front desk of the Living Waters Clinic, so she has a lot of experience over there too. And she's a pickleball pal of mine, and of course she participates in yoga and golf. So very well-rounded, and you might see her along Yorktown area. She has a dog, Bella, who's very sweet. So I'd like to introduce Laura and thank her for coming today. Please welcome Laura.
Thanks so much to Jane for that. I do have to correct, I'm board certified in orthopedics. The other stuff is the extras that I did. But I didn't have to take a test and have like heaving nervousness for the other two. Well, thank you for coming. Today we are going to talk about how to move. You've been doing it your whole lives, and now I'm going to tell you all the things that you did wrong. I mean, isn't that great? I am hearing impaired as well, as some of you probably, but I can't move and carry this. So being a professor, I was able to yell a lot. So I am going to put this aside, but if you can't hear, please tell me, because I have been in your shoes. I know exactly how that feels. Okay, so today, hopefully we will achieve these objectives. One is to talk about, well, what is body mechanics? How is it different than posture? And to understand why moving in a certain way might be better than what you have previously done, or might be more helpful to you. And then we are practicing. And we are going to have you actually do things. Okay, so this is an interactive little lecture. You can't be a physical therapist without moving. So, in every class, those poor students had to do stuff, and you are no different. So I apologize if that, freaks you out. Okay, so posture is considered a static type of activity. You don't move when we talk about posture. We talk about standing posture, we talk about sitting posture, but body mechanics is the movement, and what the posture is, or the movement during that activity. So there is a way to sit to stand that's more efficient than other ways to sit or stand. You probably all know there's a good way to lift things and a bad way to lift things. You probably have heard that sometime in your life. So I'm going to talk a little bit about the static, because you have to have decent static posture to have good body mechanics. The problem is, some of us are not able to have good static posture due to physical limitations. You know, you have a terrible arthritic knee. You can't bend your hip. You have terrible low back pain. Something like that. So when that happens, that's when you come and see me, or one of my many colleagues, or an OT, and you're talking about how can I adapt my life a little bit to be able to do whatever you want to do. Okay, so what is normal posture? What is good posture? And if you look at the skeleton picture up there on the lower, okay, if you were facing it left, you notice that red line that goes down that skeleton, and that is called the plumb line. And as a physical therapist, I visually, and as a student, we actually had little lines, so we had to stand in front of, but I visually go down that line to see what a client's body posture is. Now, as someone who's been a physical therapist for over 40 years, I do that to all of you too. I can usually pick out somebody a mile away by how they walk and hold themselves. So it is just becomes inherent in my mind, because that's what I do for my job. But if you look at that, many of you will say, that doesn't really look like me, I don't think. Okay? But the plumb line should run from the middle of your ear, down to your shoulder, through your hip, through just posterior, a little bit back from your knee, and down to the middle of your ankle. And if you have a straight line going down, you are holding yourself what we consider erect or normal posture. Now, if you look at the man with the orange shirt above, we have one thing that drives posture is the spine. And we have different ways of looking at the spine. And then this is medical, but you will recognize, some of you will recognize yourself in these little pictures. The first normal person, and I put in quotes because really no one is exactly normal, is actually, it looks like he has a very straight spine, and that isn't normal. You should have curves in your spine. You should have a curve on your neck, a little curve in your upper back, and a little curve in your low back. That little wiggle is normal for what we have. Now, the next person, where we use the word lordosis, has an excessive curve in their back. Probably no one here. Think gymnastics, okay? Those little girls. All standing there like that, right? But the next one, kyphosis, many of you are going to relate to that one because that's this. And we get this very often as we age, and there's reasons for that. A flat back is someone who really just doesn't have a lot of curves. And why that is an issue is when you don't have the normal curves in your body and you're doing, let's say, athletic activities or jumping, there's nothing, the curves sort of absorb forces. Sort of squish down and come up, you know, it's like a little spring. And if you have a flat back, you're really pounding. And those people can have some back issues due to the flat back. The sway back happens to some of our geriatric people, but I actually call it the teenage look. You know, I don't care, Mom. You know, the whole don't even use your muscles. And you hang on your hip ligaments, and you just sort of hang out. But sometimes with aging, due to our spines flatten out, and then we tend to bring our pelvis forward, and we're kyphotic, we sort of also can have the sway back. And the last one, scoliosis, you may have heard of for young, particularly young women, like teenagers who have developed scoliosis and they have to go through surgery or whatever. But it's very, very common also in our aging population as well as the spine changes and we get a curve in our back. So, you know, there's normal, and then you look at the people below, and they're all standing, and they're all fairly young, but you'll see, and I would not look at them and say, you have abnormal posture, but they do have some differences. This lady is wearing heels. She's got an excessive lordosis. That's why, when we get older, we hate heels, okay? Because as we age, we tend not to like an excessive curve in her spine. This person is standing there and she has one leg bent and one leg straight. There's nothing wrong with that. In fact, moving, well, particularly if you're standing in a line, is very important. Don't think of posture as this, I can't change. This is the perfect way and now I have to stand 3 hours as I wait for something. No, you should be moving. So what I wanted to take from here is, yes, this is perfect. But this is all okay. You're allowed to. Okay? You just can't do this for like hours or all the time, because then there will be stresses on your tissue. So you're allowed to move, but don't do anything in super prolonged. How's the level of my voice? Can you hear?
Yes.
Okay. All right, so what's normal posture and sitting? And don't move. I know you're all going to shift now, and everyone's going to say, okay, so number one with the big X, red, that's obviously not good, and number two, check, is good. Now think about how you work on the computer at home. Now when I worked at my office in the university, I had I had a standing desk, I had a sit-down desk, I had an ergonomic pad. At home I have a table, a leftover dining room chair, and I tend to type like this for whatever reason, I don't know, as I'm eating out of the pantry, I think, is the thing. Not ergonomic, but if I do it for 5 minutes, it doesn't matter. But if I worked for 8 hours that way, of course it's going to matter. And some of the things are very, very common, and people come in with problems. So let's take the guy who is not doing things well. Notice the head being very forward. And the reason his head is forward is because he has no support in his lumbar spine. He's forward in his chair. So think about how you work at your computer. Do you sit back in the chair? Most people do not, many because they're too little. If they sat back in the chair, their feet would be dangling. And that's not gonna, you cannot work like that. So I often tell patients, particularly little people, if they are in a chair, like for example, you're going to a play and your feet, for you to have your feet touch, you have to sit low, put your coat, bring a pillow, and support your lumbar spine. This is also really important in a car because many people, they drive, and we drive like this. I used to drive a stick, so that's why that's what went on. But anyway, and this rounds our back, makes your head comes forward, and then we get all this back pain. Versus I take a sweatshirt or whatever, jam it back here, bring my seat up a little bit, and now I can sit up. And my car, this is just a promo for Subaru, but my car, I can bring my seat up so my head is supported by my headrest, my car is shaped so my back is supported, and it's really comfortable. Cars have gotten much better at being more ergonomic, but still, bodies are different. You have little people, you have big people. So you have to do a little bit of, adapting. Now, one thing I notice that I always do, particularly on long rides, there's like a little bar here, and I begin to shift to put my elbow down, totally scoliosing my spine. Not a good thing. And after a couple hours, I go, oh yeah, should stop that. So realize in your posturing as you're doing things, particularly on long drives, maybe you're going to a play or to a movie, watching TV, look at the way you're holding your body and see if your body is aligned or if you are just, all over the place because you just appear to be comfortable at that time. So when you're sitting at a computer desk, generally the rules are feet are on the floor, get something for your lumbar spine. What you'll notice here is he's got an armrest for his arms. I had that at work, but I usually used a little foam pad to rest my wrists, keeping your wrist straight versus cocking it up. And for those people, this should be about a 10-degree drop. from your eyes to your computer screen. If you wear progressive lenses, like I do, make sure you are not doing this, trying to see your computer. You can actually get computer glasses if you're really working for a long period of time on your screen, but that is generally the posture we're looking for. Most of you are not doing lots of excessive computer, I hope. All right, so now, without moving, don't move yet. Sit how you're sitting, everyone's sitting, and I want you to take a big breath. And just really fill your lungs with air. Okay. Now I want you to make sure you sit, feet are on the floor, you are sitting upright, so your back is straight. Now you guys don't have any back supports on these chairs, so it's a little harder. You're nice and tall, upright, and I want you to take a big breath. Notice anything different, yes or no? You can say no.
You can breathe more.
You can breathe more. You can get air down deeper. Which do you think is better? Breathing shallowly or getting oxygen down deeper? Getting oxygen down deeper. So one of the things that good posture does is to get oxygen to your tissues more efficiently. It's a big, big, big deal. Okay? And most people don't think about breathing when they're sitting around, like I gotta sit up straight so I can breathe better. No, it's really important, particularly as we age and we begin to come forward. We've now collapsed all of this lung tissue. You can't expand it when you're here, all right? Now I want you to stand up. We're gonna I'll give you cues on good posture and standing. Now again, if you can't stand, feel free to sit down, it's totally fine. But what I want you to do is put your feet about hip width apart. Doesn't have to be perfect, but generally. And see if you're putting your weight, like sort of concentrate. My weight, is it in my toes? Is it in my heels? Is it somewhere in between? Try to find somewhere in between. Okay? Now, what I want you to do is get your hips so they're aligned to that somewhere in between. So this takes a little like, where's my body in space kind of thing. From there, can you get your shoulders, and some of you will physically not be able to do this, but get your shoulders over your hips. Now think, you are a puppet. You have a string at the back of your head, and someone is pulling that string up. Your chin should be parallel. They're not pulling it up like this. They're pulling it up from the back. And if that has happened, you should probably feel right now, my legs have tightened up a little bit. My rear end is a little tight. Ooh, my tummy is tightened up a little bit. Relax your shoulders. Now you can relax the rest of your body, meaning you don't have to keep it tight, but maintain that posture. This is really great standing posture. Does it feel weird? Yeah? Okay? Unless you're practicing like yoga a lot, or unless you're a PT that's talking about, most people do not this. Most people relax their muscles, and right away you see what happens to me. I drop down, I bring my pelvis, I mean, this is me personally, my pelvis goes out, and I'm relaxed, but I'm not using muscle tone. Versus good posture should be almost an active kind of thing. Now, you can relax. It's not like all day long you have to be in the military, okay? And you certainly can move, but it's this idea of, it's not just a blob. You are not a blob. You should be holding yourself up, okay? All right, you can sit. Thank you. Oh, you should have taken a breath, sorry. We're straight. Feel free to take another breath. Okay, so why does this matter? Why does teaching you how to move or move correctly matter? First of all, it does protect the body. It protects the body, the joints, particularly the spine. But even as I'm teaching people to move or to do things with their hands, the hands are very vulnerable. So we teach people how to move correctly if they're doing repetitive activities with their upper extremities. It's safe. So when we teach people how to move, we talk a lot about basic support. And a correct basic support so that you're more likely not to fall down. So that's one of the things. And then it uses the muscles efficiently. So if you're using it, moving in a certain way, there's more likely the mechanics around the joint, the muscle pull is more efficient than if you're moving in an abnormal way. But there is a caveat to that, and that is it's not necessarily efficient as far as speed goes or time. So when I used to go and teach to workers in a plant, they were picking up things and throwing it around, doing terrible things, but they were quick. And they wanted to be quick because, of course, they got out of the job faster. There was probably some time limit to what they needed to do. So they wanted to have speed. So there is a fine line you have to walk. And these days, I'm happy to say, about 30 years later, they have, OSHA has come in and said, no, you're not going to kill your workers. And also, work injury is expensive. So there's a lot more mechanical ways that workers do things that save their backs. But you still, you look at guys in like Home Depot and everything, and they're hiking bags of stuff all over. I mean, it's a hard job. They do it efficiently, meaning speedy. Usually it's not good mechanically. Okay, so here's a key concept. This is like the concept of the day. Okay, let me just take a drink. Everybody has heard of the core, especially with backs. Strengthen your core. No one knows what the core really is, but you should strengthen it. Well, this is the core. But I could even extend the core a little bit more to hip muscles, even chest muscles, but this is sort of the basic thing. Considering the core as a cylinder, and I use the example, if you ever had a can of Coke or whatever beverage you prefer, a beer, it doesn't matter, an aluminum can and you froze it. And you know how water will expand, and so the top and the bottom like pops up, you know what I'm saying? And then there's that, the can. That's the core. The diaphragm is the top of the can that has popped up. The abdominal muscles are in the front of the can. The back of the can, or your spine, the actual bone, this very thick, what we call fascial tissue, that's like a girdle. I mean, you cannot stretch it, it's really tight, and muscles are back there. And then you have the bottom of that can, and that is called the pelvic floor. And many people know what the pelvic floor is, but more people do not know what the pelvic floor is. The pelvic floor is a group of muscles, right here, from the coccyx to your pubic bone, that are super, super important because they control whether you're going to be continent or not. Most people think that's an important thing. They control whether your organs fall out. That's also a very important thing. And they also, so your bladder, your uterus, your intestines, everything is supported by these, and they're small, these little muscles and a whole bunch of connective tissue to prevent, essentially, everything going down to the ground. So when you breathe, that that diaphragm will come down. That oval top will descend, so it looks like a smile, okay? And the pelvic floor muscles will also drop. Now, you don't notice this. I'm sure as you're sitting there, you're not going, oh yeah, I feel my groin every single time. Take a breath. That doesn't usually happen, okay? But it actually does and happen. And if you took a big breath and paid attention, particularly if you're squatting down, you can feel that pelvic floor being stretched. Now, if the pelvic floor, the diaphragm, and all those muscles around it are engaged, doesn't mean like squeeze the life out of it, but engaged, you have a very stable cylinder, similar to the Coke can, with ice in it. And it's you can't crush it because there's ice in it. If any of that part is not working well, you don't have great abdominals, you had 4 kids and your pelvic floor is shot, okay? Don't take big breaths, and you're breathing all with your upper chest more, and your diaphragm doesn't descend much. Or if you've had a back injury, and it seems very unstable or it's very weak. Any of those things breaks up this good cylinder thing. Body mechanics are dependent on a good cylinder. So again, we can help any of those parts. It's not like you have to give up and throw your hands up and say, I'm done. But you will not be as strong as you could be if your cylinder is in good shape, okay? And we're going to take this idea of a cylinder and move it to moving effectively. All right, so just leave the people with the dishwasher a moment. We'll get to that. All right, so when you're moving efficiently, your spine is straight, so you are moving at your hips. This is a concept that so many people do not understand. They cannot. They have moved at their back for so often. They have no idea how to move at their hips. And believe me, I know this because me and my patients, we're all rocking. You are pivoting from your hips while your spine is straight. So I need to turn, I need to pick something over there. Instead of picking something like this, I pivot or I step. My spine is still straight, okay? Now this, you can imagine, this is faster, but this is better. This keeps your spine in protection. You're stacking your shoulders over your knees, over your toes. Now, obviously they're stacked here, but I want them to be stacked here too. Now, sometimes as we go forward, our knees and our toes are stacked, but our shoulders, because our trunk is long, may not be stacked. That's okay too. But notice I'm a cylinder still. This is still a cylinder, all right? Feet should be in a staggered position whenever possible. You know, the guys, I was trying to watch a football game, but I don't do that normally. But if you see somebody on the line, they're here because they're going to plow through the guy in front of them. They need that impetus, and they're not like this. They are here, ready to go. They are ready because they know the guy is going to plow into them too. They want to stay upright. Staggered feet versus this is a stronger base of support. And then when you move, engage your core muscles. Now this takes a little training because if you've ever had back pain before, neurologically, your core muscles, your deep core muscles, don't automatically fly in. If you haven't had back pain, nobody in America, your core still automatically goes. When I talk about the abdominal muscles, you've all seen like the really hot looking guy with the, jug. Do you want to show us? The washboard's down there, and the whole like obliques coming in, they look fantastic. But besides saying that, there was a point to that comment. Oh yeah, but under those muscles, there's a muscle called the transverse abdominis. That is a muscle that attaches here, goes all the way around your back, attaches to this big, thick fascial thing, and when it tightens up, it's like a girdle. Your own personal girdle you never knew you had. So if you can engage your core muscle and you train them, you will be much safer when you're lifting, pulling, vacuuming, whatever. Okay, so I've given you a couple of concepts, and now we're going to look at these ladies emptying their dishwasher. I think that all of us do, right? Okay, so we have lady on the lower side with her beautiful dishes that are green and yellow. She is squatting down. She has wonderful body mechanics, but I don't know about you. I have never kneeled to empty my dishwasher in my entire life. So realize, yes, her spine is straight, she's bent out the hips, but it's ridiculous, okay? It is totally non-efficient, good for the body, bad for life, okay? Then if we look at the picture next to it, it's not a great picture, it's hard for you to see this, but this lady has her knees totally straight, and I can tell by just how her pelvis is, and she's bent over, I'm sure we've all done this sometime, and she's taking her dishes out. Knees are locked, pelvis is round or forward, she's rounded in her back. Really puts stress. I mean, a cup is not heavy, right? I mean, no one usually has said, I pulled my back out because I lifted a cup, But that's exactly what they tell me. I was good. And suddenly I bent out to pick a pencil. Boom! and something happened. So that's what happens, because when we're not in this straight posture, that core tight, little instabilities can happen in our spine. We can shift, we can move, and in response, the body says, safety, I'm going to tighten every single muscle I can possibly and spasm you totally out so you don't do that again. So number 2, the lady over there is not so great because she's really bent forward. She's young, she'll probably be okay. Now, you might look at the lady on top and say, well, that looks a little awkward. But actually, she's got great mechanics. She's lifting very low. I think she's actually trying to take the draw out, see? Her knees are soft. So when your knees are soft, your hamstrings and your gluteal muscles can work really efficiently. Like this, with your knees straight, the hamstrings aren't working that well. You're really using these muscles. And she has her knees over her toes. Now, yes, she's leaning forward to reach, but she's got her cylinder, so she's very safe. And if you have strong back, this is a really good posture. Some of you will not be able to do this because your back is not strong enough to be able to tolerate bending forward like that and holding. You just don't have the muscle tone. All right. So what I want you to do first, I want you to sit up, and I want everyone to bend from their hips. So we get the idea of, well, what is she talking about? What is this? So essentially, you know, I tell my students, karate chop your hip, karate chop. So you feel it and come over so your shoulders are over your knees. Some of you will not have the flexibility to do that, and keep your head up, if you can, so your shoulders stay back and you're not collapsing forward. And just do that a few times. Rock. So it gets to be normal. Now, if you have hip problems, hip tightness, back tightness, you may not be able to do this. So your way of getting up is you're going to have to maybe use an assistant, maybe use your hands. You have to adapt because you won't be able to get up. Now, what I want you to do is, I want you to actually just stand. So however you want, just stand up. You don't have to have perfect posture. And then you are going to sit back, almost like you're going to sit in the chair, but you're not going to sit in the chair and then come back up. So lean and see if shoulders, knees, and toes, are they aligned, or do you do something different? And you may do something different because you can't do it any other way. If that feels really weird to you, you can say, if that feels really weird for you, you're getting up in a whole different way. It's probably not mechanically great.
I don't understand the first one.
Okay.
How can you bend without moving your spine?
Watch me. I'm not moving my spine.
You are moving your spine.
My spine is moving in space. I am not moving my spine. My hips are moving. This is hip flexion.
She's not bending her spine.
My spine is just, so my spine is not moving, my hips are moving. So you're curling more. You're doing this a little bit more. Try to keep your shoulders back and go back and forth. You should feel the motion here, not the motion here.
You feel it where?
You should feel it here, not anywhere in your spine. So look at me, see, I'm just, again, on that cylinder, and I'm coming forward again. This is a very hard concept for a lot of people to understand, because they haven't done it that way. Okay, so sit to stand, one of the first movements we're going to go through. And it sort of takes off. Many of us, most of us, if you're sitting, and I say, you know, you have to get up, right? You push off your hands, and a lot of times I don't really have to do much leg work. It's really just my arms pushing up, and then I go, right? Now, by the way, as you get older, get up and pause. This was my mother. She got up and she'd fly. She was like a fly. She's like me. Anyway, so she flew, and she was in her later 80s, and because she just needed a little time. Sometimes you need a little time for that blood flow to change, to move up. So just pause, particularly at night, if you've been sleeping and you have to go to the bathroom or something, stand up and pause for a second. Make sure you're not dizzy. But we sit, we stand, we use our arms most of the time, right? Well, can you stand up without using your arms? Because if you can, you have really good leg strength. And I'm going to show you a picture of what we do in physical therapy related to sit to stand. So very often I will say to my patients, okay, now don't use your arms. Can you stand up? And they're sitting back here, and they can't do it because they're not coming forward, pivoting at their hips. So if you are in a place, maybe think of a classic, you're sitting, you're in the middle seat of the couch, you've come to visit somebody, and it's sort of a smushy couch, and you're like, oh my gosh, I am not going to be able to stand up because I am entrenched in the couch, right? So you come to the edge of this chair, and you lean, and now if you were having difficulty, you would push off the couch, but you come and you sit up, stand up. It's a very efficient and very easy way to move if you have leg strength. If you don't have leg strength, it's really hard, okay? Now, there is a test. Oh, I should go through, okay. So if you have a terrible back, or if you've had chronic back issues, and you know, the way to stand up there is not coming forward with chronic back issues sometimes really hurts. So I'll bring my patients forward, and I allow them to use their hands, and I have them come straight up, and then stand up, okay? Because this back, if you have back pain, that forward motion usually is painful if you have problems. If you just had your total hip or your total knee or broke your ankle or whatever, and this is your strong leg, we tilt that foot way back and bring ourselves up, grab our walker, crutches, whatever we happen to use. So one leg. So, but you'll be using, you should use your arms for those. I mean, if you only have one leg, at least have two arms that are helping. So, if we're doing, which you guys are, no arms chairs, we have a little test that we do in physical therapy to assess how strong and functional my patients are, and this, I usually do this on people that are older, and you can write these numbers down, or you can get this and try it at home. I did, of course, you know. Yeah, you think you can, Deb? We'll see. Okay, but, you know, here's men, here's women, your age. How many sit-to-stands with your hands like this can you do in 30 seconds?
How many
What's 30 seconds. Now, I do have my phone if we want to do it, but what you do, so you're here, and you're doing this. Okay, 30 seconds is pretty fast. I think I got like 17. I wanted to be above, but I think I was only So anyway, this is a test we do to get an idea of balance, function, or a patient's ability to move through space, all of these things, and you certainly can play with it. And if you're competitive, like I know a few of you are, I'm sure you'll go home and do that. Oops, sorry. Okay, so think cylinder, remember? So we got some household tasks here. We have the mower. Now, if we look at the guy mowing, first of all, kudos, he's wearing sound covers, unless he's blasting his Spotify. But he's protecting his ears, but he's wearing slippers. I wouldn't go there, okay? But notice he's going up a hill and he's pushing with staggered stance, bent at the hip, and he's got power doing this. Versus if I was here. So straight, spine curved. So good for him as far as that goes. Now the guy who's doing the leaf blower, something we all tend to do here, although I'm the next man, I rake. But you know, leaf blower, what is good about this guy? First, it's hard to see, but he's got a staggered stance, and he is resting the leaf blower on his thigh. Really, really, really good idea. Because to hold something, I don't know what a leaf blower is, what is it? 5 pounds? Tops, I don't know, 3 pounds, whatever. But you're leaf blowing a long time, right? You got like that whole yard to do. If you're holding a load in front of you, like you would a leaf blower, for a long period of time, you are going to feel it in your back. So to be in a staggered stance and have that leaf blower resting, now your back just has to be straight. It doesn't have to hold, you're just hanging on to it. This is what I do when I weed whack too. I stand there and I rest that weed whacker on because I can't hold it. It's too heavy for me to hold it for a long period of time. The guy who is raking is a tough one because it is usually to one side. People don't rake like this, okay? They rake here. So staggered stance is really, really important, and what he's doing, which is really good, he's not doing this. A lot of people rake like this, okay, as they rake. They're doing a bend, they're doing a twist, versus a shift. Okay, so this is the whole cylinder kind of thing. This is not. Both will get you tired. Raking is hard, okay? It's not like when you do body mechanics, suddenly everything is easy. But it is much more efficient for your back. Vacuuming. Who's vacuumed and never had tired back? I mean, I cleaned my house yesterday and I was like, oh my God. Okay, so what she is doing wrong, she's doing a lot. First of all, she's running around barefoot, which is okay, I guess. She doesn't look real steady to me, but all right. No staggered stance. So she's just holding her vacuum and she's doing this. And she's rounded too. So she's doing this. I'm sorry, did you say something? Okay. Anyway, so yesterday I was vacuuming and I'm like, and we all do it because it's much more efficient to do this, right? Who wants to go? But if you have back pain or if you have a problem, yeah, that's the way you should do it. And then this is a killer, right? For like doing the bed, doing those corners on the bed. Aren't they a killer? So this is actually a worker, a housekeeping lady, and that is like the worst, okay? But we all tend to, we can do this. So, we're here, we're bent over, we're doing our thing. Now, if you have to do something like that, maybe your back doesn't allow you to stay straight, there's the arm, okay? Now, with doing this, you need 2 hands, but tuck in and then come up. Use your hands to help you keep that cylinder as much as you can. The arms are really important for someone who has either fatigue or back pain or difficulty moving.
Laura, would it help to have a flat back rather than a rounded?
Right. She was wrong. Yeah, she was wrong. You should have this type of thing. And you should be standing there tucking your sheets. It can be done. I do it. So, all right. I'm sure if you've ever worked in any type of factory, any nursing area, lifting has been discussed ad nauseum. And they usually have a little picture like this, a poster. And I have some issues with this. I mean, let's look at the bad one first. The key thing is his load is away from his body. He's rounded his back. He then picks it up. I mean, really, what a mess. Okay? Now this guy, though, he's fine, but I don't know about you. I don't tend to lift things like this. I can. I've got great hip and who has this much mobility unless they happen to practice yoga a lot, okay? So most people can't get down that low. And then, sit here, and now with your 30-pound weight, be able to stand up. You might be able to get here, but then you're lost, It's over. So we're going to go through, there's a video I'm going to show you that is the correct way. But a couple of things. And I always think of myself here because if anyone does not, I'm always rushing. I can do it myself. I don't need help. This is my mantra that I tend to do. And I have to say, stop. Because if you need help, get it. Know your limitations, all right? As we age, we deny our limitations, and I'm sorry we have them. And so, if you don't want to get hurt, think about it. Just think, should I have somebody to help me? If you're carrying something out, clear the area. You know, there's a classic golden retriever in my home, and I'm like this. You know, instead of saying, get out of my way. Wide base of support, legs in that diagonal. Get close to the object, okay? Do not carry something here. This will kill your back. Lift using your legs, spine is straight, and now the breathing. When you go down to lift a load, and you're about to come up, so you take your inhale, exhale, as you come up. Why do I say that? Because automatically, you're going to exert effort here, okay? Automatically, your stomach should power in because you're lifting a heavy load. Well, if you have that great core that I talked about, and you don't let any air out of that core, it creates incredible pressure in your lumbar and thoracic and internal area. So much that it can close down your aorta, collapse your vena cava, and blow out your disc if it's heavy enough. So you always want to let air out. This is why when we lift, if you see someone lifting, they are, and if they're not, you know, you see like really heavy lifters, and they're like, you know, and they're really working hard. They're wearing a belt here, so it protects their back to prevent a blowout of a disc. So there's a lot of pressure there when you're lifting. So definitely breathe, and then no twisting. All right, you may need to help me here.
In this next segment, I'll be teaching you how to pick things up from the floor safely, whether you're squatting or hip hinging. So, whenever you pick up anything from the floor, you want to get your center of mass, which is just above your belt buckle, above whatever it is you're picking up. And the reason for that is it reduces torque on your body. So, if I'm to pick up this hand towel, it makes no sense to grab it from way back here. That creates a lot of torque on my body. Instead, what I'm going to do is I'm going to get above it, and I'm going to pick it up, whether I'm hip hinging or squatting.
So here I am about to pick up something heavy and awkward. This is probably about 45 pounds, these two bags. Of course, the smart thing would be to lift one at a time when in doubt, but I want to show how to pick up something a bit heavy and awkward. So the first thing I'm going to do is to put my center of mass over its center of mass. So its center of mass is right there, my center of mass is right here. So that is going to reduce torque. So then I can either squat it, or I can hip hinge it. In either case, my back is straight and my center of mass remains above its center of mass. So either is safe. So here I'm going to hip hinge it. And I'll hip hinge it down. All right, now I'm going to squat it. And to squat it down. So either of those methods are safe, but the important thing is a straight, long spine and getting your center of mass above and as close to its center of mass as possible.
Okay, so that is lifting from the floor. But sometimes, again, you want to put something on a shelf, okay? And so you have, by the way, this is like 6 cans and a couple of chicken broth. I just took it off my out of my pantry. Okay, so you're here and you have to lift it up, okay? Do not, and they've shown this, do this, okay? Because what this is puts a lot of strain on your rotator cuff, and a nice way to blow it, okay? So bring a hand down and put it up with this guiding and this here, okay? Much easier on the shoulders, but again, feet should be staggered, spine should be tight, and you know you're moving your arms, all right? And load as close to the body as you can. Do not, well, we'll go through another thing. All right. The next thing, so he showed you, you know, the little piece of paper on the floor. And, you know, he came down and his center of mass was over. And that's fine. But a lot of times, again, remember I talked about speed? We don't do that, right? But if you go still hip hinged, still straight, but I can bend my leg and I can pick up my piece of paper. This is what we do sometimes when we golf. You've seen these guys, right? And they pivot. Occasionally I do that just to see if I can without falling over. But what he's doing is flexing his hip, flexing his knee, and his other leg goes up because there's a counterbalance for his trunk. But once again, notice my spine is straight. And using your club to give you a little balance is a smart idea. All right, throw something on the ground. Light. Just pick it up, see how you do. Are you using those, are you hipping? Do you bend down? What do you do? Pick up your pocketbook, pick up a piece of paper, throw it down. Stand on up and pick it up. How do you get it? And if you have a friend next to you, have them look at you and tell you what they're doing. And if you feel like you're going to fall over and you don't want to pick it up, don't pick it up. You don't want to catch anybody.
Or you got a number one that says, I need help.
Exactly. Remember, I need help. Right, exactly. And look at, did you do it with bent knees? Did you do it with your spine straight? Did you just bend over? Were your feet staggered? We don't have a lot of room here. But begin, the whole point is, notice how you're moving. And try something different. See how it feels. All right, so we're going to do a little critique of 3 people putting something in their cupboard. Something we do all the time, right? All right, so I'm going to keep my mouth shut and you're going to tell me good and bad. So tell me this first lady, presently over there on the left with the little black and white shirt. Good, bad, what would you improve, what would you not improve? What?
I put her on a step stool.
You put her on a step stool. Okay. Good.
That's how I look, so it's wrong.
Okay. So when you put on a step stool, let's look at the pros and cons of that. This poor little lady, every single time she gets a plate out, she's got to find that step stool, put it up, and she's got to step on it. You think that lady's going to do that? No, she's not going to do that. She's going to keep doing this because that's the only way. She's a tiny little lady. Her cabinets, by the way, aren't they ridiculously high? I looked at that picture and I was like, who has cabinets that high? But anyway, she is going to reach. So if that is you, and you're a tiny little lady like that, and let's say, and again, you have to think, how can I change this? If this person wasn't a huge cook, lived alone, I would say, why don't we take that coffee cup that you want to reach and we're going to bring it down. You can put a cup in a drawer and it's okay. You don't have to put it in a cabinet. You can put your plates in a drawer and it's okay. So very often we will have, it's usually not me, it's more OTs do this, come in and adapt a household. For now, you have a problem, we are going to change things, and people freak, but that's the way it has to be. No, it doesn't, but they're very used to the same thing. So it would be nice, I agree, she should have a step stool, and she should have one with a hand up, not just a regular step, but like one that you hang on to. But she's not going to use it, and most likely, every single time. So the other thing would be to move her stuff around. Now, I would suggest moving, but that usually doesn't go over. All right, let's talk about this lady here. She is using, I don't know if you can see, this is a chair with a phone book on top. Okay, and you probably don't even see this, but the pot is boiling on the stove right there, okay?
Good combination.
Have you ever done something like this? I bet you have. You're like, I just need that right now. I just have to get it. It's okay. Grab that, and I have some chairs that I shouldn't stand on. I'm like, I'll be fine this time. I'm sure I'll be okay. So if we look, so those are terrible things, right? But let's look. She's got a straight back, right? But why? First of all, clean up. I mean, I would put but it's such an awkward cabinet. So first of all, I hope every pot you use every single day is not in that cabinet, so you have to do this. But I would put my knee, I would get rid of the stuff and put my knee on the kitchen counter to be able to reach over to that awkward cabinet. And I would not put books on top of a chair, bad. How about this lady?
She's twisted. No, she's twisted.
So good, you're so good. Very, very good. So it's sort of interesting because all she would have had to do was turn her feet. Like her stool is facing the right direction, but she's not. So, you know, like just turn your feet and she would have been fine. She's got her stool, it's fine, you know. But we do things because we, you know, we're fast, we want to get it done. Now some of us have different ways of getting out of bed. But we're going to talk about, I need you to get that video, talk about getting out of bed, particularly, you know, this is key. I mean, it's good for everybody, but, you know, if you've had back issues, had abdominal surgery, any other major surgery, that you can't just hop out of bed.
In this video, you'll learn how to get out of bed yourself, whilst looking after your back and avoiding any risk of falling. To get out of bed, there are 4 necessary steps. Moving away from the edge of the bed, raising your legs, pivoting to one side, and sitting upright. Firstly, move away from the edge of the bed. Move to about 10 centimeters away from the edge of the bed. This will allow you to get up without the risk of falling out of bed. Secondly, raising your legs. Bend your knees so that the soles of your feet are flat on the bed and as close as possible to your buttocks. Thirdly, pivoting onto one side. In one movement, pivot your body whilst contracting both your back and abdominal muscles to protect your back.
Notice she's rolling like a log. Her spine
Whilst
is
pivoting,
not
hold
twisted,
on to the
totally
edge of the bed
straight.
with the hand that is furthest from it, roughly in line with your shoulder, to keep yourself stable and to stop yourself from falling. Fourthly, sitting up. Start by putting both your legs over the side of the bed, then push down with your left hand and right elbow to sit up in one go whilst keeping your back straight. Once you're sitting up, hold on to the edge of the bed to support yourself and to stop yourself falling forward.
Okay, so that coming to the side, and this, your legs and your trunk come up as one. And in the beginning, you really have to have some arm strength to do that. You know, as a therapist, very often I'm assisting that part, but it's a good way to get out of bed. And actually, I started, you know, like before I do this, how do I get out of bed? And it depends on the day. Sometimes I spring out of bed like, yes, and a lot of times I'm like this, which is like, okay, I gotta get up. Okay, so you can get out of bed any way you want to get out of bed, but this is a real nice way if you have spinal issues. Okay, getting in and out of a car. I got another one. For most of us, we do number 1 with the young man. We bring a leg out, we begin to move, and we step the other leg out. Totally fine, it's worked for us for millions of years. But sometimes that's too difficult to do. You don't have the mobility. So this is an OT. She's got a really great trick to use here, particularly if you have somebody that has difficulty getting in and out of a car, and you know, they get stuck and they can't lift their legs up. I thought this was,
Hi everyone,
this
it's me
surprised
Lindsay
me.
again with Equip Me OT, here today to show you a quick hack for how to improve the ease of your car transfers. So I'm going to be using a simple tool that pretty much everyone would have in their home to do this transfer, and that would be a garbage bag. So for some folks, one of the biggest challenges for getting in and out of the car is kind of getting caught up or stuck against the fabric of the seat. So if you have a fabric seat car and you're having trouble sliding your legs in and out, or you're planning to have surgery that might cause you to have these difficulties in the future, keeping a garbage bag in your car, in the glove compartment, or even folded up in your purse might be a really good idea to help make that transfer much easier. So let me show you how this works. So all you need is a standard garbage bag, and I like to fold it in half so that it's not so large. You really only need it to be about the size of your backside, or even slightly smaller, but you want it to cover the seat so that it's going to reduce the friction between your clothing and the seat fabric. Okay, so we're going to go ahead and place it in, just like that. Really simple. I want to make sure that it is exactly where I'm going to be planting myself so that I can then use it to turn. So let's pretend like I'm coming into my car and I'm going to be backing up to the seat like this. Now, because I have this bag here, and I can extend it a little bit so it's covering the edge too. So just like that, see how it's covering the edge of the seat? That'll help me slide over that little bump. So I'm just going to back up to the seat, And with that, all I have to do now is, and if somebody's helping me, they can help lift my legs, but the pivot motion, just like that, is much easier because I'm going to slide on that seat because of the garbage bag. The same applies for getting back out. So, assuming that the garbage bag was placed when you got into the car, when you go to get back out again, it's the same principle. The garbage bag's going to assist with allowing you to pivot your legs out much easier. Now, I will advise, you may not want the garbage bag up over the edge of the seat at this point in the transfer, because if you're somebody with extensive leg weakness, you don't want it to cause you to slide out before you're ready. So having it kind of back at this point is a good idea. So now the transfer is much easier. I was able to pivot my legs out, and now I can simply stand up out of the car. So there you have it. A really quick, easy way to improve the ease of your car transfers by simply using a garbage.
Isn't that cool? Yeah. I got so excited. I never did that ever, and I used to transfer these people. Like, and yeah, I was like, a garbage bag. How cool. All right. So, groceries, okay?
Oh, yes, we can.
All right. Okay, so a couple of things. If you're carrying multiple bags of groceries, they get like 10, you know, like those plastic bags, 100 of them. Balance them evenly with both hands. Do not? No. Okay? Tips you over, very unstable. If you have, let's say you know that your knee is bad, you know, you've had arthritis or something in this knee, put the bags on the other side. Decreases the force on the sore leg, okay? If you're lifting, here's my grocery bag. Here's my car, okay? So, hatchback, okay? And my groceries are back. Do not, or even in the, what happens like, you know, after the woman packs the groceries in, and you grab, do not grab like this and pull out. Will kill your rotator cuff. Bring that bag to you. You can use, if you're using this kind of grocery bag, you know, or handled one, you can lift, or with your bent elbow and lift. Do not then try to put your groceries up on your kitchen counter, which is this, right? The swing, as we swing it up. Okay, sure way to hurt your shoulder. So there's some other home kind of tips to consider. And then, this is something I always ask my patients. This is really important. Can you get up from the floor? Because you know what? One of these days, you're going to be down on the floor. It may be a fall, and maybe you went down on the floor to do something, and you say to yourself, I can't get up from the floor. If I have to get LOW fire here, this will be so embarrassing. So, I want to talk to you about getting up from the floor. And you know, if you're a weak person, this is not an easy thing. So if you know, if you have a spouse or a partner that has fallen and they're weak and you're not super strong, call the fire department, okay? They will get that person up from the floor. But you should practice getting up and down from the floor, because you may fall and you may not hurt yourself, you know, like you're not broken bone, but you still got to get up. So how do you get up from the floor? Well, I've asked my patients and said, I do this all the time. I say, how do you get up from the floor? And I make them demonstrate. So there's no super, you know, you have to do it this way. You do it per what your body allows you to do. So if you have a really bad knee, you can't lean on that knee. You're not going to use that knee to get up from the floor. So first of all, let's get down to the floor. Your grandchildren are saying, Grandma, come play with me. And you say, I want to, but I can't. I can't get down. All right, so if you're having bad extremities, usually we sort of get our hands by bending and we get down to the floor, okay? Now to get up from the floor, different ways. One way, my patients tell me, is the same way. And they walk up there, okay? Now, if you have fallen and you're lying there and you're usually not in any shape to, like, let me get up from the floor in a perfect manner, and there's a chair right down and you're here, you know, you've fallen, certainly use the chair to get yourself up from the floor. But it is something you should practice. Many of us, like, you know, we can't put our shoes and socks on anymore because we can't reach, and we can't get down to the floor because we have stopped doing those things. And those are two things I ask every patient. Can you put your shoes and socks on? Can you get down, up and down from the floor? Especially if they live alone, they don't have someone to help them. So feel free to talk to me about, you know, how would I do it? So just to review, for the best mechanics, you need strength in your core, your legs, and your hips. You need decent balance, you need good joint mobility. But if the above is not possible, you may need to make adaptations, lighter loads, slow it down, and use adaptive equipment. And a couple things, a stool with the handle on it is good. What you don't see here, okay, so this is the coolest thing I think ever. One of those things, again, I said, they make this? This is like a little handle, and it goes into the, you know, the sprocket or whatever that your door would lock into. But if you, now this woman has no problem getting up and down, you know. But if you had someone who had real problems getting off the seat, you can push on that and it's just a good stable lever to have someone stand up. So if they had had surgery or just generally really weak or, you know, it is, and here's the other thing it does, which I thought was sort of amusing. But it is something that concerns me. What happens if I go over a bridge and fall into the water? How, with the automatic windows, do I get out of my car? These are the things I think about. Anyway, it has a thing that you hit, and the glass breaks, and then supposedly the same person who's using it to stand up is supposed to swim out of their car. And go. Not sure that happens, but anyway. So it does that. It also will cut your seatbelt if you're trying to get out. So I'm not sure these are the same people that are using it for all these things, but you know, it's there. And then there are all sorts of stuff online. This is just if you had a problem getting up out of bed or a low chair, you have all these little things that can slip on under things to help you push up. So there's stuff out there if you need it. Thank you very much. Does anyone have any questions?
Laura?
Yeah.
I have a truck, so my question is getting people in and out of the truck, and they want to climb right in their own way, no matter what I'm using.
Yeah. When you're a small person and you have to get into a high,
Yeah, and
it could be like a high bed. I mean, a high bed would be the same thing. Very difficult because really you have to do these are people that usually are not thinkers. So the best thing is for you to have a stool.
Well, I have a step, but they still want to put both of their feet on that step.
Yeah. And they can, I mean, what I would do is have them back up. And again, some people cannot back up and step backwards.
Well, the seat's too high.
Yeah, but I would probably have them, so here's your, okay, let's make a car. Here's your truck. All right, so your truck is, here's the passenger seat, but it's like here, you know, it's higher, and I'm coming, and here's your stool. I would probably have, my best bet, you're too unstable to put both feet on the stool, it's too small?
Well, I have a step, no, so it's a small step.
Okay, no, I would get a stool, and I would get a stool with a handle, and have them use that, step up, and then, and better to even turn and sit, but that might work, that might not work. You have to see how the layout of the truck is. But I would get a stool, because there is no way they can get up on that little thing and balance, or
Some of them do pretty good.
yeah, yeah, well, it should, because they're just like hanging, you know. So that's how I mean, because you're right, those trucks are very, very high. And that is something to think about. If you're older and you're buying a car, really think about your mobility into the car. Like, you know, the men who buy the hot sports cars that are like really low, in 10 years, baby, your total hip, you're not going to get in that car too easily, you know. So, I mean, think about that when you're purchasing Yes.
I'm sorry.
No, go ahead.
On the LOWLINC bus, we have a step up, and you could use that on a bus or a high car.
Yeah, same kind of idea. Yeah, yeah. Any other questions?
Thank you, Laura.
Yeah, thank you.
I have a question. What is it with transfer boards? I interviewed a client and was telling me that they put a transfer board in the car. And so they could slide more easily out of the car on that.
Yeah.
And they had it down pat, but I just thought, I don't know if this is I took a picture of it.
Yeah, no, it's fine. It's sort of like the garbage bag idea, except the were they mobile? Were they walking? Were they in a wheelchair?
They're getting into a wheelchair with their wife's help.
Okay. So a lot of times, again, if the height of the car is similar, you can put a transfer, it's like a bridge. You know, it goes from the wheelchair to the car and you can slide, mainly for people that are not able to stand. They would use it. Now, again, if your person is so incredibly weak, you know, sometimes they can stand, but it's just really, really hard. We've used transfer boards. It's awkward, but if people have gotten it down, yeah, it's safe. It's good. So.
It's an observation. I've had trouble getting out of chairs if they're very low.
Yes.
And so now I add a pillow, like even on my couch, I add a pillow. If I'm sitting on a pillow, I don't have any trouble getting out.
Right. And so, because what happens when you're on a low chair, your hips have greater flexion, obviously. Imagine I'm, you know, down here. Okay. So they're greater flexion, and you have less, the mechanics requires more strength. So when you're on a high chair, you don't have that issue, because now it requires less bending of each hip. So yes, that is a very good adaptation, and many people that would be fine, except what happens if you happen to go out and you're sitting on a low chair? You know, so that's why, as a therapist, yes, do that, really good. We have to strengthen your legs. And then I would work on, and very often I start with them high, they have to do sit to stands, and then I take away that pillow, or I give them a skinnier pillow, and then I take away that, and then I bring it even lower, and they work on getting up and down, and getting their legs stronger. Because you're right. So, and you know, sometimes people, it doesn't matter, they have terrible pain somewhere, and so it's not going to change, and that's a great adaptation. Anything else? Well, thank you very much. Have a great day.